health correspondent Nicola Hill joins us from London. Nicola, this is very interesting because there's so many grandparents out there who haven't seen their grandchildren, so many children that haven't been to school for so long. What does this latest thinking change with regards to children and COVID-19?
Well, it is interesting, isn't it? Because it does seem to be a bit of a volte-face. At the beginning of this pandemic, we were told that children are the super spreaders. That's why the schools were closed. This is based on the fact that normally with colds and flu, children do spread it. They all gather together at school, they come home, they give it to their parents, they give it to their friends. And initially in China, research seemed to show that this was the case with COVID-19. But in fact, it's not true, apparently, or so scientists believe now. Now, the change in this started with a boy in France, a 9-year-old boy in France. He tested positive for the virus, and they traced the nearly 200 people he'd been in contact with, and not one of them tested positive. And that's why people started doing more research, such as these people in Australia. Now, this is the National Centre for Immunisation Research and Surveillance. And what they did, they followed 9 children and 9 teachers from a total of 15 different schools who tested positive. They traced nearly 881 people they'd been in contact with to see if they were going to become infected. And only 2 of those people became infected. And it's believed they were both infected by the teachers, not by the children. So this is quite amazing.
It really is. And just to go back to that story that you mentioned about the 9-year-old boy who contracted COVID-19 in France, and he was in contact with 170 people, and yet he didn't give it to anybody. Just to be clear, why? Because normally they would or could give the flu.
We don't know exactly why. The theory is that children are either getting an upper respiratory infection, which then means that they're less likely to shed a large viral load. They also think with children, the reason why they're not so badly infected is because their immune system isn't overacting in the same way as adults' immune systems work. Any more than that, they don't really know exactly. I mean, you mentioned the article in the British Medical Journal. Now, there's 2 experts from Southampton University and Southampton Hospital have written this article. They're experts in infectious diseases. And they also looked at this French case, the Australian study, but they also looked at what's been happening in Iceland, in South Korea and in Italy, where they've been monitoring this contact tracing. And in one town of Vo in Italy, the whole population were tested. 2.6% of the population were positive, yet no child under 10 was positive of COVID-19, even though they were living with parents and with relatives.
That's fascinating. That really is. So what does that mean for children going back to school now? We saw Wuhan, the epicenter of the origin of the coronavirus, the children there going back to school. How do you think this will change policy in the UK and other countries that are still maybe thinking of much later on in the year?
Well, these 2 infectious disease experts writing in the BMJ have actually said what many people are saying, is that schools should reopen. They're saying if children aren't the super spreaders, why are we keeping them at home when they're possibly at risk of not only not able to continue their education, but some children aren't being fed because they get free school meals, or they might be in abusive households and they need to get out. And then I was speaking to Professor Linda Bold from Edinburgh University, Professor of Public Health, and she said that now this has been debunked that children are super spreaders. That's why in Switzerland last week and in Denmark yesterday, grandparents are being told they can hug their grandchildren, which of course is something that they all want to do. But it's also a case of workers who use our grandparents as childcare. So if children are allowed to mix more widely, then that's going to be a benefit as well.
This is a great story, it really is. And very quickly, any sign as to when schools will open in the UK? Just very quickly, in a month?
No idea. We're going to have a discussion or hear more on Sunday, apparently.
All right, Nicola, we'll leave it there. Thank you so much. Nicola Hill, live for us there from London.